Avenue Doctor's Consultation on Cosmetic Surgery and Dermatology with Dr. Louis M. Fetter, board-certified dermatologist and cosmetic surgeon. Dr. Fetter is the author of About Face, published by Warner Books, and is the host of his long-running cable TV show, Here's Looking at You.
Welcome once again to Here's Looking at You. You know us very well by now. We've been here for many years, and each week we try to tell you all the things that you may be wondering about, cosmetic surgery or dermatology or fashion, health, anything that comes into our minds, we want to share with you. Some of our viewers have the chance to go to the, I know you're in all the big, some of the new stores, H&V, which record stores?
We're going to be in H&V in Tower.
I have two very interesting, very unusual New York guests who are going to tell us their experiences, both cosmetically and their lifestyles, and all the stuff we're going to tell you will be very inside, really kind of fun stuff. Here are real estate brokers in New York. Jody, good evening.
Good evening.
Nice to see you.
Dr. Fetter has also hosted a series of nationally broadcast skincare specials with John Davidson, Juliette Prowse, and Richard Bay.
Retinoids are here. Can they make you look younger?
Can you look younger? I mean 10 or even 15 years younger and stay younger looking forever?
John Davidson found the answer for himself.
My skin looks younger. At 47, I'm awful glad I'm using Dr. Fetter's facial regimen.
Yes, it worked for John Davidson and for all these patients of Dr. Louis Fetter, noted Fifth Avenue dermatologist and cosmetic surgeon. Now, for the first time, you don't have to travel to New York to Dr. Fetter's offices or pay for any doctor's visits to enjoy the years younger, vibrant results once available only to a select few. Introducing the doctor's own 3-step retinoid youth regimen to fight the visible signs of aging, to attack wrinkles, age spots, blemishes, and renew environmentally worn skin without a prescription.
Here are teens and adults who've learned how to win the war against acne. Its American TV debut was in 1992.
Please welcome Dr. Louis Fetter. How are you? Good to see you.
Dual Action went worldwide in 1994.
We've all seen the scarred faces of friends and relatives due to acne. Fully 1/3 of all adults and 85% of all adolescents will suffer some problem with pimples during their lifetime. But now, why don't we hear from Dr. Fetter on that subject? Here he is from his Fifth Avenue offices. Dr. Fetter, is acne really all that common?
Oh, yes, it is. In fact, it's one of the most common skin diseases I have to deal with, both medically and surgically, in my practice. Richard, adults who have never had acne in their teen years often come to me in tears.
But you have a new gel formula. It worked so well before. How have you managed to improve it?
I'm always working to improve my treatments and formulations. Richard, I was very excited when I discovered that the natural ingredients in green tea, when added to my gel, left its power intact, but made the gel much more soothing to the skin, even for first-time users. This regimen represents total skin care at a price I believe everyone can afford. And it's going to help so many people keep their skin younger and healthier looking. I'm very proud of Dual Action.
Thanks, Doctor. And congratulations on your 5th anniversary of Dual Action.
Thank you, Richard. Just since 1987, when I released my first video on the subject, new and innovative procedures have been created. I am proud to say that I have participated in the development of many of these new and innovative techniques.
We recently did a television show with Dr. Louis Fetter, and we talked about spider veins, and I'm telling you, the reaction to it was absolutely enormous. So many calls, so many inquiries, and I'm sure they came into your office as well.
I'm telling you, have me working through the end of next year.
Dr. Louis Fetter is considered one of the best plastic surgeons and cosmetic dermatologists in New York, and the leader in the collagen procedure on the East Coast since the 1980s.
I think the traditional facelift is dead. The incision cutting here and here and here, and merely pulling, we're doing that because the patient has lost the tissue inside the face. What we do, we put tissue and we layer it inside the face. And as a result, we just rejuvenate the entire face doing it that way.
Fox News Now.
With us now is cosmetic surgeon Dr. Louis Fetter and one of his patients, Kimberly Taylor. Did good work here, Doc, you know?
Well, she's a very beautiful lady, and, you know, this is very common. Most women look well, and they want to make themselves a little more perfect. They have a certain figure, a certain habitus. They want to improve it. Exercise alone many times cannot do that because these are little areas of fat concentration unless you have it sculpted, not sucked.
Sculpted. Does it hurt, Kimberly?
Absolutely no pain.
None at all?
No
Are you
blood,
knocked out?
no blood loss. It was under local anesthesia in Dr. Fetter's private operating room in his Fifth Avenue offices. The day of the surgery, I walked to the cab by myself, was home, minimal downtime, no scarring.
I think today the procedure that we do for the liposculpture, I do it all by hand. I don't use a machine. I don't like using machines. I get no irregularities, and I take that tissue and I can remold it and use it back in the face or in the hands or other body parts to augment that part.
What do you think? Is this the wave of the future, Doc? We're all going to get this in the next 20 years because the boomers are already
There are a
lying
lot
about
of things
it.
you can do, and even things you can do without surgery. For example, the Botox for the fine wrinkles in the forehead.
Yeah.
That's fantastic for wrinkles. Surgery can't make that go away. Some small injections, you lose the wrinkles. Or instead of a facelift, many times I'll come in from an area here and I'll build up the face under the skin with no scar.
Yeah. Any merit to being ruggedly handsome, like, you know, people
You can
might
do that
say
too, but
growing old
I'm
gracefully?
little touch-ups make you look as well as you want for you is what I think is the wave of the future.
Okay, Doc, you did a good job with Kimberly. There you go. Thanks for coming in, both of you. Appreciate it.
Since 1990, the number of cosmetic surgery procedures has jumped 109%. And it's just not women who are going under the knife. We spoke to one cosmetic surgeon who says more and more men are entering his office, and liposuction is their top request. Take a look.
Men are coming to recognize that they become successful in business, and they do well, and they make money, and they're worrying about exercise and all, but they don't look well. They're getting these paunchy bellies, and they're having very heavy areas in the breast. For example, whenever I see a man that's heavy in the belly, invariably he'll need me to do some work on the male chest. Liposculpture today, liposuction, I call it liposculpture, is the most common cosmetic procedure in the world today. And it's a very safe operation. It's not the way it used to be in years past, where they used very thick cannulas and by machine and get all kinds of bleeding. There's literally no bleeding and there's no pain. Men primarily are interested in taking care of the abdomen and the love handles and the double chin. Those are outpatient procedures. It takes an hour or two to do it. It's very safe. It's cost effective. And I'm getting perhaps 40% of my practice is now men who want these procedures done. Besides liposculpture, we do a lot of what's called autologous fat transplantation. Most men don't need facelifts. This may sound very surprising to you. Merely to cut your hair and pull back is not replacing the actual tissue loss, which is the main problem in the aging face. I take the body's own tissue. I take the body's own fat and other fibrous tissue, and I treat it, and I concentrate it, and I put it back into the face. Laser surgery is very big. I combine that with dermabrasion, and I can literally rejuvenate the face by 15 or 20 years. I can make the face brand new again. So after scarring from acne or trauma, and certainly from sun damage, these are major advances. So that, coupled with the liposculpture and the facial rejuvenation with light chemical peels and things of that sort, and using the proper products at home, men recognize they have to look as well as their female counterparts. And they're doing it. And they're coming in droves.
Now, if you are thinking about cosmetic surgery, Dr. Fetter says you should consider two things. First, if a surgeon immediately suggests a facelift, walk out. That's not the best procedure in many cases, he says. Also, check with your insurance company. Reconstructive surgery that corrects a physical defect is sometimes covered. And get to know the anesthesiologist very well. That's a tip from Bill.
It was a gravitational issue. I mean, everything just started pulling down.
I got tired of looking tired.
Gail and Francine were both looking for an easy way to a younger look.
A lot of people that I had seen that had facelifts looked very phony, and they didn't look real to me.
The thought of going under the knife is really very, very scary to me.
This is plastic surgery, but just the work is done under the skin without scar.
Both women turned to Fifth Avenue cosmetic surgeon Dr. Louis Fetter.
This procedure, I call it the weekend facelift, because we do all that work, and if I do it on a Friday, you're back to work Monday.
It's called the face fill. It's about a 1-hour procedure where fatty tissue is removed from one part of the body and re-injected into your face.
I like the idea that you're sort of recycling something that you don't need in one area and putting it back into another.
There's really no obvious telltale signs of having this procedure done.
That's right. There's no nip and tuck, so there aren't any scars. And the results are still pretty dramatic. Dr. Fetter does the procedure in an operating room in his own office. After applying a local anesthetic, he removes some extra fat from your hips or your abdomen. The fat is then cleansed and treated with a growth hormone and then re-injected into your face.
It's good for the nasolabial depression. It's good to augment the cheekbone area. It's good for areas in here. People get that very deep frown line.
After the fat is injected, the doctor molds it into place.
The sculpting is the most important part to give a very natural, contoured look.
Since the fatty tissue is your own and it's still living, your body won't reject it. And unlike collagen injections, your body will retain most of it for years. So touch-ups aren't as frequent, but if you need one, the doctor is prepared.
I take out extra tissue so I can freeze some extra tissue, and when the patient comes back for a touch-up, we go right to our freezers, we thaw it out, and we re-inject it back into the patient's face. I try to compare this procedure to a balloon. If the balloon loses air, do you put more air in the balloon, or do you pull the skin of the balloon thinner? The answer is obvious. You put more air in the balloon. In this case, we'll put some more fibro-fatty tissue to re-augment that beautiful rose.
This sounded great. It sounded like the least intrusive option.
So does it work? Judge for yourself. Here's Francine before, and this is what she looked like after her face fill.
I wanted to put back what was missing.
Gail went for it too. Here she is before, and this is her after the procedure. So how does fat from your hips feel when it's in your face?
Feels totally like me.
Linda Schmidt, Fox 5 News.
All over the world, people have come to realize they do not have to accept the appearance nature has given them. They have come to understand that looking good and feeling good really go hand in hand. And the best part of this regimen is that it is safe. It is not a drug, and therefore does not need a prescription. Many of my patients have used it with perfect results. Of course, as with most cosmetics, if irritation or discomfort should occur, stop the regimen. Good nutrition, avoiding undue exposure to the elements is also very important in the battle against aging. Thank you very much.